I'm Ron Stout, the CEO and president of the Ardmore Institute of Health. We are a nonprofit foundation with a focus on improving the way America cares for itself. We began many, many years ago, some date us back to about the 1940s, where we were actually building hospitals in rural Oklahoma. We got out of the hospital building business and asked ourselves, how do we keep people out of hospitals? And a part of that journey is we built the Lifestyle Center of America. And our focus was on helping people overcome chronic disease, the most prevalent being diabetes. And we found that we could dramatically improve not only the numbers, but the health and well-being of individuals. The Lifestyle Center of America was a valuable tool, but it used a huge amount of resources and it reached a lower number of people than we'd like. So we closed it and we became the granting foundation we are today. The Ardmore Institute of Health has had a real focus on the devastation caused by chronic diseases. And one of the ones that is the most ubiquitous, particularly with the changes in the American diet and the nutritional environment that we now live on, is this issue of obesity-driven diabetes. And trying to tackle some of these big picture issues before they end up with people being hospitalized or losing an arm or a foot or a leg or whatever is this idea of facilitated self-care, which many of us now call lifestyle medicine. It's not complex, it's not expensive, and it flies in the face of people waiting to get sick to see their clinicians. And so it's this construct that we're helping prevent and treat, and yes, even remediate or reverse chronic disease that gives us great joy. Over the next 10 years at the Ardmore Institute of Health, we really want to focus on bringing the tools of lifestyle medicine-infused whole person care to the lower sociodemographic, to the people that need and deserve it most. And to do that, we're looking at 4 different areas of concentration. Number one, we're going to continue working on what we call translational primary care, making lifestyle medicine, making whole person care doable in the primary care setting. And so a second focus that we're having is this construct of community medicine, where we build environments where people that need to go on a health or want to go on a health journey can do it together with other people of like mind. Any journey we try to take by ourselves is far less enjoyable and often less successful. And then as we look at the aspects of translational primary care, community medicine, one of the things we've really come to realize is that there's a huge opportunity in behavioral health. And I know I'm being provocative, but that's what I do. We would like to help the behavioral therapy field transition to a point where it's considered, if you will, malpractice. If they're working with a patient that is stressed, is anxious, isn't sleeping well, and they don't talk about the principles of lifestyle medicine. As the American College of Lifestyle Medicine, Ardmore Institute of Health, and similar entities think about how to bring lifestyle medicine-infused care to the masses, our job is to really think about not what is doable as we build a business for ourselves or as we do a boutique approach to health, but what the real focus must be is how do we build systems, scale, and synergy, because that's what's going to make this premise sustainable.